The project's currently being implemented across 5 local government areas in Ondo State, including Ifedore, Idanre, Ileoluji, Okegbo, Ondo East and Okitipupa, focuses on combating HIV and AIDS, tuberculosis, malaria and gender-based violence. The State Program Officer, Mrs. Olajumoke Ogunyemi, said the project empowers communities to take full ownership of their local health facilities. She noted that the collaboration between community structures and key stakeholders has led to timely identification and resolution of service delivery challenges.
We're also done at Ilera Market. We have the one conducted by Lurodev at Anaye Market, Ondo State, Idonre, local government. Then we also have the one for Bamikemo, also carried out by Melville in the local government, and we have Erije community. For the small group discussions, like we said, is more like our focus group discussions. So what we do here is we target artisans, target food vendors, target hairdressers, target farmers, target different class of individuals, and sensitize them in an enclosed small group session, and meeting them, also sensitizing them on GBV.
According to her, the results are already visible from ward development committees mobilizing resources independently to infrastructural upgrades in health centers. She equally noted some of the achievements recorded between April and May include provision of chairs and bedding, repair of faulty motorcycles, floor tiling of clinic spaces, and installation of electric poles to improve power access.
We have, apart from this, we have the GBV outreaches conducted in June. So remember, we said these are the locations at which we all executed, we carry out some of those activities that were displayed in the previous slide. We have GBV outreach at Samo community by Labdo organization.
Mrs. Ogunyemi further appealed to government agencies for continued support, especially in the areas of staffing, supply of essential medical commodities, and availability of antiretroviral drugs for HIV patients. Representing the director of the Ondo State Agency for Control of AIDS, Odisaka, Mrs. Olubukola Adegbulu, commended the project for mobilizing community resources to complement government efforts.
Well done to what you have been doing in the States. Yes, we can feel the impact of what you are doing. And he still wants to assure the team again that the agency is there to support at every point in time that the agency is needed.
She called for intensified advocacy by implementers and community leaders to ensure lingering issues in healthcare facilities receive swift action. Also speaking, a community leader, Chief Komolafe, praised the initiative for rekindling community participation and narrowing the gap between healthcare expectations and actions. The state malaria coordinator, Mr. Adeyemi Junaid, urged local government chairmen to leverage local government autonomy in addressing pressing healthcare challenges within their jurisdictions.
I want to appreciate the organization and on behalf of Ondo State RSSH Development Agency for your support and your goodwill towards Ondo State in general. And I thank you for everything that you've been doing. Yes, we see your hand. And I will implore us to not forget our data and our reports so that we can know how to feed the agency back.
On a part, a representative of Newman, Mrs. Ayomide Jayola, expressed gratitude to project implementers and encouraged them to remain committed to delivering quality healthcare outcomes.
Bring together all CSOs so that we can mobilize domestic resources. And that is what we have already been doing. We've been doing it in our own way. And the only thing that will encourage us is to add more to it.
The NACA RSSH C1MRM initiative is fast becoming a model for community-led healthcare reform, transitioning rural communities in Ondo State from reliance on government to self-determined development.